This is where we live as startup founders, right? We live just outside of established norms. In the way we think, in our ethos, like you can't tell a startup founder that something is impossible. You've just asked him to attempt it. That's the sort of inclination we have. Immediately you say something is impossible, you have people, and you are saying you are going to do that exact thing. You're going to have people who will give you reasons why. So sometimes I find that the task is to be able to demonstrate in a consistent way, congenial way actually, the word I should use in congenial way, is to say why what they are saying is wrong and why what I'm suggesting is right and can be done.
All right. Good day to you all. So today I have here three of my amazing co-fellows doing very wonderful things. And they are all founders of various companies at various levels or various stages in their organizational journey. So today we want to talk about everything: scaling, piloting, funding, and everything in between. I mean, I just happened to be here moderating the session. I mean, brilliant minds. Ooh. So they're going to introduce themselves and they'll tell us what they are doing. And then we take up the conversation from there. So to start off, my name is Grace Nelson. I'm a pharmacist. Um, and I'm also a women's wellness advocate, trying to, ensure women are almost always well. Yeah. Maya, tell us what you do.
Sure. Hi, Grace.
Hi.
How's it going?
Very well, thank you. And you?
Awesome. So, I'm Maya. I am trained as a medical doctor. I'm Tunisian, but I also have a background in public health. And I recently founded my nonprofit, which is called MedNTech. It aims to leverage AI and tech to democratize access to preventive healthcare services for women across the continent. Good to see you all, and very looking forward to having this conversation.
Thank you. Thank you, Maya.
Maya.
Tosan?
Yeah. My name is Tosan Mogbeyiteran. I'm from Nigeria. I'm a startup founder. I'm the founder of Black Swan. Black Swan provides enterprise level software solutions for development challenges, and we've done so now for quite some time. My own personal specialty is in machine learning algorithms for public health, global public health challenges as well. I'm excited to be here, Grace.
Great.
Thank you.
Interesting. Thanks, Tosan. And then Nimah.
Thank you so much, Grace. My name is Nimah Zani Kassim. I am from Kenya, and I am a communication strategist by profession and a gender and public policy expert. I am also the founder and the executive director of the Hijabi Mentorship Program, which is a grassroots organization that works on the intersection of gender, policy, and leadership. And I'm really excited to be part of this conversation because it's essential.
It really is essential. Thanks, Nima. So I'll just start with you, Nima.
Yeah.
I mean, I know Hijabi mentorship program has been around for some time. I think 8 years.
Yeah.
Yeah.
7.
Okay,
Yeah.
that's good.
Yeah.
I mean, we still have some nonprofits, some organizations, even after the number of years they have spent, over 7 years, they are still running as a briefcase organization. How have you managed to, make Hijabi mentorship grow to the level it is? Because I can see now that it's grown beyond you, the founder,
Absolutely.
because you have the opportunity to do so many things and the program is still running.
That's
How
true.
have you done that?
Well, to be honest, it's been a journey, Grace. And I will not lie and pretend that we didn't start as a briefcase organization. I think that's where a lot of startups begin with, and it's part of the
Maybe you can
journey.
give our viewers what's a briefcase.
Just to clarify to our listeners, a briefcase organization is more of an organization where the founder runs everything. So, like, it's like a working office. You're like a working office. You have everything at all times. But once an organization moves past that period. It means that now it's operational. It means that there are systems there and they're working. And you don't need the founder, as a founder, you don't need to be there. You don't need to be present anymore. So when I started Hijabi, to be honest, I had never had administration experience before. In fact, I started this organization when I was still in school. So it was more of an idea, and it literally just started as a mentorship class session that, I was like, oh, let's go visit the school because there's this issue. And then from there, it evolved into an organization. But what I would be grateful for is the mentorship that I received early on in the journey, because one of my mentors sat me down and informed me of the importance of structures. And he said, at some point, Hijabi should be able to grow beyond Nimah. Right now, you may have to hold its hand, but imagine a world where Nimah is no longer there. What is going to ground Hijabi? And I have been working consistently with my team trying to build these systems, trying to create these structures that are going to ensure that even without me, Hijabi can continue moving on. And I think that is where a lot of startups usually fail, because as founders, sometimes we like to hold things to our chest.
That's your baby. Need to cut.
Be like, "Yeah, this is my baby. I cannot share a lot of financial information people may steal. I cannot share this. They may copy my idea, but there is power in letting go." And that is what I learned. Yeah.
There is power in letting go. Wow.
Yeah.
That's my first takeaway from this session. Thank you. Thank you so much, Nimah.
Thank you.
And then I come to Maya. MedNTech has been, relatively new among the startups founders I'm speaking to. A year old. I know you've done a pilot in Rwanda, which went super well. Would you want to tell us more about it?
Sure. So MedNTech is a nonprofit. It's similar to a startup, but the sustainability model is a bit different compared to a startup. And I really founded it based on my values, putting impact at the center of what we do and not necessarily generating revenue. And I think that's a difference between what I do and the model that I decided to go for. And yeah, so we've been working for a year now, or a little bit more, on an AI-based mobile application to enhance cervical cancer screening, more like an assistance to healthcare providers who don't know necessarily how to conduct cervical cancer screening across many countries, really, in sub-Saharan Africa. So the main goal was to really enhance coverage in terms of cervical cancer screening. At later stages, the aim would be to enhance accuracy as well. That takes a lot of data and a lot of iterations. Eventually, we will get there. But back to your question about the pilot. Finally, we had the opportunity to go on the ground and test the AI application into real-world scenarios and real community-based clinics. And it went very well. We screened 260 women.
Amazing.
And a lot of what you said, Nimah, really resonated with me in the sense that it takes community as well to make your innovation succeed. You can conduct or design a mentorship program or build an app, but if you don't have the community by your side, then you won't really get far, because you won't have anyone coming to get screened or get tested. And maybe, Tosan, you have something to say about this as well, based on your work.
Yeah.
So please feel free to share this with us as
Oh
well.
no, you are entirely right, Maya. So the key thing to, which is a mistake that really occurs in our industry a lot, because a lot of the programs and technologies that are designed and implemented largely originate outside of the communities.
Yeah.
And you can't provide genuine help and avoid being condescending if you don't identify with the people you are helping. And so as development professionals, we tend to run the risk to be condescending in our work. And it's not unfair it's an outcome of us having knowledge that we think the people in the community don't have access to.
Sure.
And what knowledge tends to cause pride inevitably as its outcome. But it's humbling, the humility and the grace to be able to integrate into the community that you intend to help. And it gives you a truly unique perspective. In any case, to be able to successfully achieve sustainability, you have to secure community buy-in.
Yeah.
And that's what, Maya, you were speaking to, the deep acceptance that must occur to the people that you intend to integrate with. And whether we admit it or not, technology systems that we design, these artifacts, are really just notions and ideas that we captured in hardware or software, depending on as the case may be. These notions intend to assist people and must exist within an ecosystem. You know what I mean? So, for example, in our case, we had to design this immunization system that would, with the intent to increase demand for routine immunization in northern Nigeria. And despite all the attempts that had gone on for decades, people hadn't really gained traction in the region. And so some of the turnkey ideas we implemented for that intervention came from speaking with the people, right? In one element of the intervention we designed, we had to redesign the immunization card into an album. And where we got that idea from was a very traumatic experience where a mother had just lost her child. And we were in the community during baseline assessments and having conversations with different stakeholders to try to understand what the shape of the problem was. And I'm a doctor, I was in the community, and like a child had died, and people came to get me asking if there was anything I could do. The child died in the primary healthcare center. There was no doctor on seat, but there was a community health extension worker. And in panic, people rushed to get me. There's a doctor in the village, come, and I got there, found out that the child had died from vaccine preventable illness. And the mother was, and she was in her own dialect because I had an interpreter. And she was saying that she did everything she can, droning on and on. I did everything I can. I did everything they said I should do. I did everything I can. And in a bit, I didn't know what to say in that instance. So I just sat down on the floor with her for a while. I don't remember how long we were there. But when she got up, she thanked me. I didn't say anything. She thanked me. And she was walking away, and I got up. My legs had gone to sleep. So I got up and we asked. I don't know what even pushed me to ask. I just asked. I said, if you had a picture of your child, would you like that? And she responded and said, if I had a picture of my child, the picture would belong to me. The child belonged to God. And that stuck in my mind. Stuck in my mind. And one of my mentors said, there you have it. Add a picture into the mix. Give parents a picture of their child at every immunization visit. So many times when I'm called upon to talk about the work, I always center the people that are at the heart of the work. Because if we listen as development professionals, they will give us the ideas that would work.
Yeah.
And
Yeah.
Thank you. Can I add on to that?
Yes, please go on.
Thank you. I'm so sorry. I could feel the emotion in you, and I'm also very emotional when it comes to things about children. But one thing you say that really struck me is the aspect of community buy-in and the whole context of localization of solutions, because there's a lot of assumption that we know better, but in reality, the people know
No
better.
better.
Yeah. So I'm thinking, as people working in the development world, maybe we should stop seeing these people as beneficiaries and more as co-creators of the solutions that we're making, because they can see, they can speak, they can hear, they can feel. And if we want them to be part of the solution, we want them to take ownership of the project, because this is what will actually result to the success of the work that we're doing. Yeah.
Yeah, you're right. I mean, what you say speaks to agency,
Yeah.
right? And there's deep agency in the communities that we serve.
Yeah.
Yeah, and that's the framing I think that works best. We serve them.
Yeah.
Yeah.
And there are also sometimes internal barriers to the person. For example, having something against vaccines is just against their principles or against a given treatment. So you can go ahead and bring like the best evidence-based treatment that you have out there, but nobody will take it in the end because you haven't asked the question. Like, is this aligned with your values? Would you take the treatment if you know the effects, the positive outcomes that could add to your health? And then you would be just running in circles and asking yourself, why isn't this working? Like, I'm bringing out the best innovation out there, but you don't know your audience, or in that case, your users or your patients. For me as a doctor, then you won't get you won't get anywhere.
Yeah, actually, it's true.
What you say is true. Like,
Yeah.
so this is a conversation that I have with funders often, and I say this a lot to a lot of the funders that support us and a lot of the collaborators we have that are international partners. There's a profound shift, historically speaking, in our science that had to validate the notion of vaccines. Right? There were profound medical discoveries as a species that we had to achieve to be able to design these vaccines. Now, we live in a world where the vaccines are pervasive and many of these notions are taken for granted.
Yeah.
Right? But some of the people we serve haven't made that conceptual leap. And the idea is that diseases are caused by things you can't see, and that you can prevent illness in a healthy person. And so, in many of the conversations I had in the community at the beginning, mothers would ask me, my child isn't sick. Why should I take the child for an injection?
That's okay.
The child is sick, give injection. Now you're saying I should give injection before the child gets sick. Doctor, explain that.
Well, good luck with that.
And I have to say, you got me. This is a different case.
Yeah.
This is how it works. Right? Germ theory was a significant leap for us as human beings.
Yeah.
And we take it for granted now, but we have to lead our communities through that same layer of discovery.
That's true.
Yeah.
Right? And that's the responsibility that we have.
Just a hot pursuit on that takes me back to doing the parallel with cervical cancer screening. And many women in the community actually had the belief that we would take out their cervix and not put it back there.
Yeah.
And this is what they say when they go back to their community. So imagine if one woman gets checked and actually you have this conversation with her where you explain what you're exactly doing, and then she goes back to her community and says, this is actually false. This isn't true at all. You would just get tested and you would know your status and you'd be healthier and happier. And there's like this ripple effect where, positive impacts or positive or just demystifying really screening or reproductive health in general, it could have impacts that we can't even consider in the first place. So that's very important too.
You're entirely right.
Yeah. Okay. So thank you all so very much. You've shared great insights. I mean, that wasn't the way I even thought our conversation, but I love it. I love where you've all come from. Now, I mean, 2 nonprofits, 1 startup. I know one very key thing, especially in running nonprofits,
Yeah.
is funding. So just this February, I lost my job because I was working for a USAID implementer, and overnight, USAID pulled out.
We were all affected, Grace.
We were unaffected, yeah. Maybe you still haven't eaten us.
The whole world. Yeah, the whole world was affected.
Yes, and I know I mean, some of you, Nimah,
Yeah.
Tosan, I know your organizations, I mean, receive some funding from
From your
donors.
side, yeah.
Nimah,
Yeah.
I mean, in that period, I
Mhm.
mean, I know you're supporting women experiencing gender-based violence
Yeah.
and all that.
Yeah.
I mean, how did you navigate that period, and how have you been able to, we don't know when the funding is coming back.
Yeah.
How are you pulling through this period?
To be honest, I wouldn't say I have figured it out, yes. I think it's a learning journey, and I think that's where most of us are at. Because in the end of the day, we cannot pretend we do not need these development partners. And something that Tosan said to me a while back was on, the reason as to why we need them is because some of these services that we provide, we are giving it out for free. For example, for our case, Hijabi, when a woman goes through any form of abuse, we support them with, medical care. We handle legal support. We provide them financial support. If we're supposed to find a rescue center for them, in case we don't, we have to pay their rent for a particular period of time. So these are vulnerable populations who wouldn't be able to take care of themselves. So in the end of the day, we still need development partners to support the work that we're doing. But for us as Hijabi, what I can say has really worked is alignment to county level and national priorities of our country, Kenya. Because I believe that if the work that you're doing as an organization is aligned to the particular priorities of that particular government or the institutions that have already been laid out, then it makes your work easier. For example, it's easier for us to collaborate with the government. I don't know how it is in Nigeria, but in Kenya we have county governments and the national government. So it's easier for you to collaborate with the county government if the agenda you're selling aligns with them. So they may not be able to provide you with everything, but they're going to support you with what we usually call there's a word for it that I can't find. Maybe someone will provide you with a venue. They may say, you know what,
In-kind supports.
in-kind supports, exactly. They provide you with a paralegal pro bono. I'll give you an advocate pro bono. So it has been that kind of alignment and that kind of partnership and collaboration that has seen us through those dark times. Because yeah, there have been some dark times.
I can imagine. I can imagine.
No, I mean, yeah. What Nima, what you say is very correct, right? I mean, being aligned with the government provides some degree of protection and stability,
Yeah.
right? And you're right. We have survived on in-kind support, since this very interesting period, right? But we still had to sort of trim the team, and that was an inevitable outcome of this. We were a tributary of USAID funding, from conceptualization of the project to this stage. I mean, and so in that regard, they've been, very generous, both in terms of how we conceptualized it and how the project came to be. And so, yeah, they've been a critical partner for us, and their presence is sorely missed. Another thing it's important to know that you were saying, and I think is very, very profound, is that many of these services are it would be ethically irresponsible for these services to go out,
Yeah.
in any form or way. And so that puts pressure on our funders to be able to come in different ways to support this. And some of those support funds, bridge funds, I could call them, have been very helpful in how we have survived. But it has required that we rethink our strategy greatly, right? Scale back our ambitions to be able to provide help. We are not providing help to as much people as we would love to, or as we were providing help to. But we've kept ourselves alive by being nimble and being a startup. And that's what the ethos of a startup really is, which is sort of the way that I think the team rallied around the idea to be able to deliver this. People are depending on us. It's ethically irresponsible to let the absence of donor funding interrupt our service. Focus on high priority need areas, right? Areas that would entirely fall apart if we weren't in place. And then seek support for bridge funding, right? It's not a one size fits all.
Yeah.
And
Yeah.
it doesn't entirely, I wish I could tell you that it solved all the problems. It didn't, right? But it's kept us in play and kept us alive and kept many of the communities that we are providing support to in a good place. Well, in a great place compared to where they would be if our service wasn't in place. You see what I mean?
Okay. Thanks, Tosan. I mean, coming to you, Maya. So your organization is in a pilot phase, and Earlier today, I was having a conversation with Tosan, telling him that in my country, I've seen very great health innovations 7-8 years back, and now something comes up and I search for them and they're nowhere to be found.
Yeah.
And I'm like, oh, what happened? I mean, these people were doing so well. I mean, it looked like they had great potential. What can we do as a continent to move us out of, for lack of a better word, as Tosan will say, pilotitis?
Or if you call it the pilot trap.
The pilot trap.
Listen, I mean, it's not my coinage, dude.
To move away from the medical terminology to me. So it's very sure it came from Tosan, right?
So, I mean, we pilot, we leave it. We want pilot something else, we leave it.
Yeah.
I mean, how do we scale? 'Cause
Yeah.
I would like to see MedNTech scale from the pilot to actually a full-blown,
Yeah.
um,
Me too, Grace, to be honest. No, but seriously, get back to what you said. And you've got a point in the sense that we're not lacking innovation. What we're lacking is implementation and support for scaling these interventions up. In our case, for example, yes, the pilot went very well. We had promising results. Of course, we need to build on that. But one of the things or barriers that I noticed myself as the leader of this organization is when you start considering scaling this up or implementing this in any other African country, you will need to start everything from scratch all over again. So this is the problem. This is a systemic problem, actually, because it shouldn't be this way. Technically, you have a proven solution, you have the metrics, you have the data, you have the proof that it's working, but you need to go all over these processes again that are very heavy, very time consuming. And I'm talking about ethics approval, I'm talking about data privacy, the whole bureaucracy process that really differs from one country to another. And you have different policies as well. And yeah, of course, like you're very familiar with that. And I'd like to have your perspective about that as well. But I think just to spin this around and rather framing it as a barrier, framing it as a solution, I think we need to work together as a continent to fast track solutions that have been proven elsewhere and just facilitate the process. If you're working in East Africa, for example, and you have a pilot with metrics that worked and was really integrated well into the system, then you should fast track this in Kenya or in any other country. If I started this in Rwanda, then it should be easy to, do it in another countries as well, at least neighboring countries, because Africa is very, very big, very large continent. And so I think this is where our governments could talk and work together. And so that would be at the country level. But if we zoom out a little bit and we want to address this from continental level, then I think big bodies like Africa CDC or the African Union could facilitate that process by start to have these conversations, at least to build ethical frameworks or guidelines that would, at least guide how we should proceed or how we should approach this, and then to respect the sovereignty of all countries. The process could be tailored from one country to another to make it fit with their own priorities and strategies. And that way you hit like a very good middle ground of fast tracking, but at the same time also respecting the country's priorities and policies as well. That's how I see it. But yeah, I'd like to have your perspective about how we're operating this. Is this efficient? Okay, what do you think?
I mean, so building on what you said, I mean, yes, there are some harmonization frameworks, that makes you implement or get approvals faster in other countries, so long as you've piloted or you have an approval from one country.
Yeah.
So I'm speaking from the pharmaceutical perspective.
Okay, yeah, because this sounds industry specific. It sounds very ultra industry
Yes,
specific.
so yeah.
Yeah.
So I mean, there are harmonization frameworks where because you have an approval from Ghana, it is quite easy to get an approval in Gambia, in Sierra Leone, in Liberia because they
Yeah.
have MOUs,
Okay.
in place. But I think it will be very good to, replicate this in other areas.
Yeah, I mean, so
Yeah.
it's an interesting question you raise, Maya, and a quite complex question. I think one way that I'm thinking about it is, first of all, the dynamic of what a startup or a pilot's intention is, as opposed to what a government's intention is. So there's a mismatch. Like, it's startups have a narrow experimental utility, right? But governments are built and designed for stability,
Yeah.
right?
Yeah.
And that's where the question of bureaucracies come in. I think bureaucracies are humanity's most optimal way to achieve stability for large societies or large agglomerations of people. Bureaucracies are how we have nations. If you take away bureaucracies, we won't even have states, right? So, but the problem is, and this is where the dynamic comes in, to be able to change things and change things at scale, as startups and startup founders, we have to leverage the strength of bureaucracy while minimizing or dampening down the negative tendencies of bureaucracy, which essentially can be summed up as slowness.
Yeah.
Startups are built for speed,
Others.
bureaucracies are slow.
Let's slow.
Right? I think that's how I'm perceiving what you are saying, right? And so there's that mismatch.
Yeah.
It's a selection mismatch, right? So a startup will select ideas that deliver a solution that are ultra specific for high speed, but a government will select a solution for an entirely different criteria, which is why they tend to make us startup founders go through the entire process again. Because the conversation for a government or a government agency is, the evidence was generated under our watch, so we will back it with our approval. And this is something that I had to learn the hard way, right? Like, what happened was, I mean, I'm talking with ethical approvals and compliances, and it's a pain, because as a startup, you're optimized to be cheap, in quotes, right?
Yeah.
Cut costs, keep
Yeah.
costs lean.
Efficient.
And some of these requirements are not cheap, and they are not fast.
Just applying for approval from the FDA, it costs a lot of money.
Yes. So, these are the constraints. And so there's a dynamic, a push-pull dynamic that is at play here. And that's the case. Another thing is, some of those regional conversations that have been had in the drug industry. The drug industry is one of the most mature industries that we have in the world. So some of these conversations that we are having for technologies that AI is only about, how many years? So, okay, well,
I mean, I perfectly agree.
I don't want to be inaccurate, but our modern iteration of AI is no more than about 6 years,
I agree
7
with
years.
you. I mean, I have approached some regulatory agencies on behalf of MedNTech to, ask them questions about regulating AI in health. And clearly they don't have guidelines in place. They don't have, anything in place. They've told us to watch out.
Yeah, they can't.
Wow.
No, I mean,
Yeah, because it's just happening now.
Yeah.
but the future looks good.
Yeah. No, I mean, so look, this is where we live as startup founders, right? We live just outside of established norms. In the way we think, in our ethos, like, you can't tell a startup founder that something is impossible. You've just asked him to attempt it. That's the sort of inclination we have. And these are things, I'm not just saying this because I'm speaking with this, I'm speaking conversations with Nimah in mind, you, Maya, in mind, attempting to do some of these things. It's just far out there,
Yeah.
right? But, and immediately you say something is impossible, you have people, and you are saying you are going to do that exact thing. You're going to have people who will give you reasons why. So sometimes I find that the task is to be able to demonstrate in a consistent way, congenial way, actually, the word I should use in congenial way, is to say why what they are saying is wrong and why what I'm suggesting is right and can be done.
Okay.
So yes.
Tosan. Thank you, colleagues. Maya, Nimah, Tosan, it's been a great conversation. I really wish there was more time, but we'll definitely continue this conversation another time.
Yeah.
Thank you so much, and I'm so happy I had this conversation with you.
Thank
Yeah.